From the very beginning of the public health movement in London, England, the impact that has been made on the lives of all communities, taking into account public health initiatives, have been greatly impacted. The first time public health truly broke into public life had to do with the severe outbreaks of disease in London in the mid-1800s. While few could figure out what was leading to these massive outbreaks, John Snow figured out that cholera was being spread through the sewer systems. At the time, sanitation was very rarely available, especially to middle and lower class citizens. This made it so that cholera outbreaks were widespread and very dangerous when they occurred. When public health initiatives started putting in better systems for the benefit of public health, a revolution was born to ensure easily preventable outbreaks such as this could be actually prevented by society. Today, public health's work and advocacy efforts can be seen all around us, from our sewer systems to vaccines and different TV ads. Public health has made sure that we can live our day-to-day lives without fear of getting sick from the things we do every day. Some of the most essential work by public health goes unnoticed in our day-to-day lives. All starting with John Snow, we started to understand the spread of disease. Our water, sewage, food, air, and everyday items could be contaminated with bacteria that can make us very sick. Programs such as the Safe Drinking Water Act and the EPA are in place to ensure that these things are safe for humans to live without worry that this bacteria could severely harm us. Problems such as the Flint water crisis arise all the time, so having a group such as public health to advocate for public safety is of the utmost importance. At the beginning of the Flint water crisis, groups in charge of oversight did not think that the water supply could possibly be the cause of the outbreaks and sickness in Flint. Public health stepped in because there were very obvious health concerns with the entire community, and it was found that lead levels in the water was a major concern. From this example, we learned that old lead pipes would begin to corrode into the water and lead to massive epidemics and sickness for entire communities. Since this problem, public health has been a major advocate in checking lead levels in water, especially in areas where this problem was prone to start again. Without a system such as public health, it's likely we would have originally solved the problem in Flint, but the larger problem associated with these lead pipes all over the country would likely have been ignored. By stepping in, finding the root cause of distress, and extrapolating those causes to ensure other communities are not ignored until the problem grows is exactly why public health is so essential in our day-to-day lives. We as citizens do not have to worry about whether our air is clean enough to breathe, our water is clean enough to drink, or our food is safe enough to eat, because public health has implemented protections to ensure that these things are kept safe and that there is any action if rules are not being followed. Preventing disease in the first place is also a major aspect of the services provided by public health. Vaccines are typically inactive species of bacteria that cause certain diseases, which are injected to prompt the immune system to know what to produce to fend off an attack from that active bacteria. Creating these vaccines has been a major step forward in the overall health of our communities, as when enough people are immunized, a herd immunity is created for the community, allowing those who cannot get vaccines due to current medical issues to be safe from contracting diseases, which would be even worse in their conditions. This is why a large part of public health works in this area have been making sure that the majority of those who can be vaccinated are actually vaccinated, and why vaccines are typically free, or the people who get the vaccines actually get a little bit of a supplement for getting that vaccine. Over the last couple of years, and with the rise of the internet, misinformation has come out against vaccine, some including linking vaccines to autism. This is creating a rise in those who do not vaccinate their children, leading some diseases which were originally eradicated in some countries, such as measles, to make a comeback in kids. This is why public health has also played a large role in making sure that the public has the correct information about vaccines and what they actually do for humans. As this herd immunity has started to go away in some communities, as there is a spike in anti-vax communities. By creating new vaccines and educating the public on the real costs and benefits of vaccines, public health has greatly reduced the amount and severity of diseases we deal with in our day-to-day lives. The anti-vax movement, drug companies, and other things that are counterproductive to the public's health have led to initiatives of advertisement to give the general public the health standpoint on many things that are available to us in our day-to-day lives. For example, before the 90s, tobacco was advertised as being non-harmful to those who smoked. It is very apparent especially to teens and those who were not around during the height of tobacco use, that tobacco is severely harmful to those who use it. That is mostly because of the advertisements put all across TV and the internet showing the real effects. Initiatives like this stop possible harmful substances from being covered up as beneficial and keep the general public educated on what they choose to do. Overall, public health's introduction into society and the initiatives it has started since its birth in the 1800s has been a great success of the health of all people. Having these initiatives enacted to ensure that we can live our day-to-day lives peacefully is very important to the health of our communities and the standards in which we live. Without public health, many aspects of our lives would be potential hazards for sickness, and our life expectancies would be nowhere near where they are today. With the combination of clear information, safety of our resources, and preventable measures, public health is essential to the way we live.